Are you seeing a therapist?
Shut up.
God forbid you should improve as a human being. You're just afraid to look at yourself.
No, I'm afraid to look at you because you're ugly.
You're the ugly one. You're ugly on the inside.
Then go outside.
Are you crying?
No. You know that shampoo that says no more tears on the bottle? There's tears.
Welcome to It's About Nothing. Today the topic is mental health and therapy. Okay, Cameron, so I think you know where this script comes from. We were just talking about it before.
Yeah.
Everybody loves Raymond.
I'd like to begin by unreservedly apologizing for my my non-imitation of Robert Barone. I just wasn't capable of capturing that voice. But yeah, it's a great scene.
It is a great scene. Well, it's actually a bit of a schmozzle from it's not from one episode. I took it from a few different parts of an episode. And I think actually we may have actually swapped roles a few times there. I'm pretty sure that you're the ugly one, you're ugly on the inside line is probably a Robert Barone line anyway. So
my favorite was the grumpy granddad, Robert and Ray's dad. Frank
Barone. Yep.
Frank Barone. Yeah, I liked him.
Yeah, well, it's one of those shows where if you watch it, they do these fantastic scenes, unlike other sitcoms, which are always cutting to different scenes and sort of jumping from one location to another. They can have like almost an entire episode in like the living room where they're just having one long stream, like a monologue followed by another monologue. And so in order to get something like that right, I think the writing has to be quite good because it gets your attention. So it's really interesting. It's like it's very different from like the Seinfeld and the Simpsons, the ones we've been doing so far. So I reckon that's if you watch some of the best episodes, the best episodes have a big showdown in the living room, and they're all basically just playing off each other. And that's what I really like about it is you can just sit back and watch these actors go for it.
Like, and it tends to just have the kind of the one storyline. There's not as many subplots going on in that show. I think that's right, isn't it?
That's
right. Something you're jumping from. There's like a main storyline, then there'll be sort of two subplots maybe going on as well. Yeah.
Yeah, well, I've got a friend who makes movies and television shows. He's a director called Nick Verso. He's Melbourne-based. And he was explaining to Ramsay and I, because we actually developed a TV show concept and script. When we had, I think we got a bit carried away. We ended up having something like 12 characters. And they're all quite interesting. And he looked at it and, with his experience, and he said, look, it's all really interesting and funny, but the best shows out there have a very tight cast, and like as in for sitcoms. So like basically Seinfeld has 4 characters and they have lots of secondary characters that come and go, but ultimately there's 4 and you only have to get your head around 4 characters.
Yeah, I think in Seinfeld, when Jerry and George are writing their pilot script, like at one point they lament that they've lost track of one of their characters, or there were too many characters. I think it might be when Elaine is complaining that, they haven't written a woman in. They're sort of supposed to have a woman in the script, but then they complain there's too many characters to keep track of. And I don't know if you've ever read War and Peace, but like it's a big book, obviously, and they list all the characters like as a cast there for you to refer back to, because there's just so many of them, and it's kind of impossible to keep track of everybody.
Well, you read the Game of Thrones series books, The Song of Fire and Ice, don't you?
Yeah.
And the author of those books, he said that when he was getting taught how to write, and he basically betrayed some of these rules later because he didn't agree with them, but he was told that if you're writing a story, you can't have like 2 characters with a name that's very similar, otherwise readers get confused. So, for example, having 2 male characters, around the same age, say called Peter and one of them called Paul, people would confuse it because they both start with P. So you've got to be really careful about, you have to make the names really different.
But he breaks that rule, doesn't he?
He does, yeah. So he basically said that when because he loves history, he said if you go through history,
Mm.
then you end up with loads and loads of Georges.
Yeah. I was just thinking that because like one of my favorite books in recent years is the Wolf Hall trilogy, which is sort of set in the court of Henry VIII, and basically all the women are called Anne or Jane, maybe one or two other things, and all the men are sort of called, Henry or George or Tom or something like that. Like there's not that many names floating around, so that's just life.
Yeah. Well, if you go through those like the family trees of like royal families and things, and you look at them to try and figure out, which is the one I'm interested in reading about. And sometimes you get really confused because you go, is that George II? And there's another one over here, and it's really hard to follow because they're all got the same names.
Yeah.
Speaking about like sets that don't change, so obviously in Raymond they've got that one set with a really good script. There's also a movie I was watching last night, actually, called it was an Alfred Hitchcock movie.
Oh, which one?
Well, by the way, I'm pretty sure we watched it on Netflix, but it might have been Stan. But they have, I think they've brought all the Alfred Hitchcock movies onto one of those platforms, which is really
great.
I've
been watching a bit of it lately. I think you're jumping to the last segment in the first segment, but that's.
I know. I did intentionally. I wanted to throw you off.
Yeah, damn you.
Yeah. But it was it's called. I bet you haven't seen it. It's called Rope. Have you seen that?
No, I haven't seen that one. I've seen all the really famous ones. Like I rewatched Vertigo the other week, which I might leave to talk about another time, but tell me about Rope.
Well, it's I won't tell you that I haven't watched the whole thing yet because last night my wife Christine fell asleep, so I had to stop it because I knew that we'd have to rewatch it tonight. And so, but it's basically the premise is two friends have just murdered one of their other friends, and they've invited some people over for a dinner party, almost in a way to, secretly gloat to themselves that they're able to do that and still have the party and hold the perfect crime. It's basically get away with the perfect murder. Okay. And it's fantastic in that this is made in the 40s. And I was watching the opening scene, and this is for me, I was like, this is original. It's interesting. And then they have this really fantastic set. And I was thinking, wow, the set's amazing. And then it occurred to me about halfway through the movie, we're still in the same set. And obviously it was amazing because they only have the one set and they had to really dress it up.
Yeah. So, he does that, something very similar to that with Dial M for Murder, I think. Like a lot of it's set in the lounge room of this apartment. Like not the entire movie, but the vast majority of it. And it works really well. And I'm trying to rush through my mind to think, if he does it with other movies.
Probably Rear Window maybe as well a bit.
Well, Rear Window's the one where it's the guy sitting in the wheelchair, right?
Yeah.
Yeah, in fact, that's a very good example. It's almost exclusively set in that apartment as well. Yeah.
Yeah, so I guess we'll move on to the topic for today. So we'll bring in Ramsay in a minute. So Dr. Ramsay Dixon, who's a clinical psychologist and one of my good friends as well. But the topic we were going to discuss today was mental health and therapy. So I'm a psychologist, Ramsay's a psychologist, and usually when I introduce myself to people, they think I'm probably a therapist, which I'm not. Probably wouldn't make a very good therapist, I don't think. I'm not sure. But I do consulting in organisations, and most people are kind of baffled by that there's psychologists working in just as ordinary sort of business people in workplaces doing work. It's becoming more common today, but yeah, generally speaking, psychology is thought of as a counselling role or a therapy type of role. Certainly right now, it's an interesting topic because we've got this pandemic as well as lockdowns in Victoria and Australia. We've had lockdowns across the world. One of the most topical things that comes up is if we lock people down or if we put restrictions in place, is this contributing to an unseen mental health crisis? Are we going to be burdened with something that's worse than potentially the medical issue if their suicides increase, all that kind of stuff. And also, I guess, besides people having mental health crises, there could just be general problems with depression, anxiety, and worries of the future that people might have. So where they will seek out some extra help and assistance. Plenty of people we've seen who can't run their businesses and things would obviously be, some of them would be in quite a lot of distress, and no doubt many people worried about the future. So I think mental health will be, it was already topical. In fact, I believe that in Victoria, they were going to do like an inquiry into mental health.
This is before COVID.
This is before, yeah. It was definitely becoming very topical before COVID. We were getting a lot more workplaces. We used to get a lot more consulting work with, like, business improvement work. A lot of workplaces started to come to us much more for well-being services and supporting employees. Yeah,
and the stigma, I think, of talking about depression and mental illness, mental health more broadly, is really breaking down, or has over the last few years.
Yeah, absolutely. I think you're right. It's people are much more open about having, anxiety and depression and worries, and, I guess it's public figures coming out and talking about it, but I think just in general discourse as well, it's not as frowned upon as it used to be, where, it was a secret and you'd go off and see a psychologist or a psychiatrist, and the family wouldn't talk about it because it was a guilty secret. Now it's become much more out in the open. And if anything, I think a lot of the workplaces are talking about stress and fatigue and resilience is another sort of buzzword that gets thrown around as well. That people are recognizing that there's an absolutely essential ingredient as a person's mental state in order to do their job as well, and that if they're not functioning at their best, then it's not good for anyone. It's not good for business, and it's not good for them.
That's a good point.
So one of the interesting things that's popped into the media, and I don't know if it's been validated or not, but for quite a while, people have been saying that the suicides are going to, what about all the suicides, and that the suicides are getting out of hand. And I don't know if Ramsay will have an opinion on this later, but as far as I could tell, just factually, I don't believe that is the case. At least, whilst there might be slight increases, it's not a pandemic of suicides. Like
you're talking in connection with the pandemic, right?
Correct. Yeah.
Yeah, and particularly in relation to Victoria, or
any place.
Yeah.
I'm not sure. Like, because it's hard to disentangle as well the mental health issues related to the pandemic, and then the mental health issues related to restrictions, because they're kind of all mushed in together, aren't they?
Yeah, I mean, one thing that interests me is, I mean, without really going into the detail, but what I have heard anecdotally, just through my own networks, and then what shows up in the numbers. So anecdotally, I have over the last sort of couple of months heard one or two stories, sad, very sad, obviously, of suicides, but you don't know the circumstances necessarily. And then there were numbers out, I don't know, a month or two ago, but they sort of reflected the first lockdown period. I may be wrong, but I don't think we actually have numbers on the current period. So when those, and I'm not even sure what the frequency of release of those numbers is, whether it's a sort of quarterly thing or an annual thing, or how that works. But when those numbers do come out, it will be interesting is hardly the word, but yeah.
Yeah, you're right. And also, I think there's a lot of things that we won't know for a long time anyway. There's lots of long-term effects. So there's long-term effects on the economy, long-term effects on mental health, physical ones as well from the actual virus. There's so many things that we just don't know. So it's very hard to make any firm conclusions in 2020 as to the true impact and what the decisions are. I think that's going to play out for a long time, and it's going to.
I would say,
yeah. Yeah, indeed. And now one of the reasons I selected that Everybody Loves Raymond script with Robert Barone was that I was cycling through the characters in my head about the characters on television shows and in movies who are potentially people who are really struggling in life. And this character, Robert Barone, for anyone who watches the show, is basically the older brother of the lead character called Everybody Loves Raymond. And in many ways, you could argue the show is kind of about him, because that's almost like his catchphrase. Everybody loves Raymond. Robert says that because
Yeah, it's like his complaint, right?
it's his complaint, yeah. And his younger brother gets all the attention. He's got the wife and the 3 kids.
Mm-hmm.
Robert lives at home with his parents. He always struggles with relationships. He's, you know, he's an odd looking guy as well. You know, he's concerned about his appearance, and, you know, big lanky sort of character. And and his parents are also a bit crazy as well. And the way he carries himself is almost like someone who's quite dejected all the time, always kind of a bit moping around, life's against me, that kind of character. And but the funny thing is, I'd say if you were to survey like 100 people and ask them who's your favorite character on Everybody Loves Raymond, I bet you more people would say Robert than they would say Raymond, the lead character.
Yeah. Why do you think that is?
Well, I think people like characters, don't they? They like people who are interesting and a bit quirky, I think. Whereas
maybe they like people who have flaws or sort of are a bit vulnerable. Maybe they sympathise with him somewhat. Yeah.
Yeah, they see themselves in him, because I think the same as Seinfeld, right? As well. I think if you were to ask people their favourite character, I think most people wouldn't say Jerry. They'd say Kramer or George or Elaine. I think above Jerry more often than not.
Yeah, they often say George. Like I think you saw Jason Alexander when he was out here earlier this year, and I did too up here in Canberra, and he was saying people constantly come up to him in the street and say, all my friends say that I'm just like George. And he says that's not a compliment.
Yeah, well, I think so. I think that you're right, because I think what you see is you appreciate the characters who've got insecurities. And if anything, I think you've probably hit the nail on the head in that you probably enjoy your friends and family, the ones who actually do have vulnerabilities, because they're more human, and that you probably like the fact that you've got other people around you who are kind of human, as opposed to someone who's perfect. I think it would kind of probably grate on you after a long time if someone's absolutely perfect all the time. And I think that's what the show kind of portrays, that potentially that, you know, this person who's otherwise perfect is actually really annoying because they're perfect.
Yeah.
So we might bring in Ramsay. So I'll just to introduce Ramsay. I mentioned before, he's a doctor of psychology. He's a clinical psychologist. He has his own practice, so he has his own therapy practice. People come to see him, and a one-on-one counselling type arrangement. He also does workplace consulting as well. So he looks at well-being in the workplace and the sort of factors that get in the way of well-being and mental health in the workplace. And he used to be quite the tennis player as well. He was a pennant tennis player at one stage in his life, and I'll probably be making him feel a little bit depressed himself, like Robert, because I don't think he's played tennis in a while. And he had to get back into it. But yeah, when I first met Ramsay, he used to play every weekend, was quite a competitive tennis player and quite passionate about that. So we might bring in Dr. Ramsay Dixon now. Ramsay, are you there?
I am. Thanks for having me, Nick. Hi, Cam. How are you?
Hi, Ramsay.
Are you still playing tennis, Ramsay?
No. Thanks for bringing that up, Nick.
Yeah.
Very, very helpful. But sadly, no. After a serious leg injury, I never quite got back to it. And so, yes, that is a part of my life that is no longer prevalent as it once were.
Do you think that if you lost, because you lost tennis, which is like a passion, a real interest, but also a good sort of outlet, do you think that has an impact on, like, did you have to replace it with something else?
Yeah. So I'm lucky, I suppose, to have quite a few diverse interests. And I think that's right, isn't it? If one outlet closes up, another one. So I've got music, I've got movies, I've got family, I've got lots of things to work on that give me relaxation and enjoyment. But I think if it was an all eggs in one basket situation, it probably would have much more of an impact. And so, I guess that ties back in a little bit to what you're talking about with the impacts of this pandemic on mental health. I was going to circle back to the suicide conversation that you had already talked about. there's so much to talk about. It's hard to keep up, whether it's Everybody Loves Raymond, whether it's Alfred Hitchcock, or whether it's mental health. Just glad to be a part of it and see where the conversation goes.
Yeah. So, what's from your experience? So now we're sort of in the pandemic. It's been quite a while now, and I know just from our discussions, you were saying that there's been like a influx of people coming in. There's a lot more people wanting therapy during this period. Is that what kind of increase has it been? Are we talking about a twofold increase, or is it like 10% or?
Yeah, look, I think this one, I don't know what the overall statistics would say, so I can only speak to my own practice, but probably 25% or so increase. Some people coming back who have previously had some therapy, but for various reasons, some pandemic related, some not, have returned as well. And I think that goes to what Cam was saying. It's easy to assume that every help seeking or sadly suicide is related directly to the pandemic, when it might be other factors as well that just happened to occur or would have occurred regardless of Corona. But yeah, certainly it has been. And I guess what I'd say is that there's probably two main ways that's been sort of being played out. So the first is those who are having directly related problems arising from the pandemic. So this might be health-related anxiety about catching COVID, or obsessional worries about giving it to someone else.
Yeah.
Or people who are very dependent on their family for support, but because of the travel restrictions and they live far away, that sort of thing. Or people who have lost people to the illness itself. So you've got that sort of pathway, direct effects. And then I guess it goes back a little bit to the outlets that you think about. So you can imagine, I don't know if you might be familiar with the cup and water metaphor, you two, I'm not sure. But if you think of a cup and you put it under water and the water's trickling in, what's going to happen to the cup? It's going to fill up. And eventually, if you leave it under the water long enough, what will happen? It will overflow. And so one way of stopping the water from overflowing is to poke holes in the cup, right? So you still got water coming in at the top, but you've also got outlets, literally water outletting from the holes. And so in that metaphor, the person is the cup and stress is kind of the water. And so Corona, what it's done effectively is blocked outlets for people. So this is a sort of non-direct path. So people who used to go out with their friends, who used to play sport, who used to have a community at the footy club, to go to dance classes, et cetera, used to visit their family. If you think of all those holes getting kind of plugged up, then people's stress levels are getting to the top of that cup and some people are overflowing. And so it's not that they've directly got a mental health condition because of the pandemic, like the first pathway I mentioned, but it's that cumulative effect, if that makes sense.
It's a good point, because it's like if you go to like sort of those fundamental needs of a human being, which are like one of them being that kind of these social needs. Definitely, that's probably the biggest impacts have been the social needs. Like you think about, it's not because you can still exercise and do those things, but the socialization is really decreased.
Yeah, it's interesting. Sorry, go ahead, Nick.
No, you go.
I was just going to say, like in the first lockdown, I mean, I always have to preface this by saying in Canberra, our experience has been much lighter than what's happened in Melbourne. But in the first lockdown, people were talking about it being, heaven for introverts. Like, if you're not that inclined to go out all the time anyway, you've got a great excuse, and you could stay home and make sourdough bread or something and post it on, Instagram if you felt like it, and get lots of likes and all that sort of thing. But so, some people do better than others, obviously. So there's some people who don't need the social interaction as much, and I'm probably in that category in a broad sense myself, although having said that, I haven't gone through this intense period of second lockdown in Melbourne, and I suspect that's something completely different altogether, where you've had very little or no interaction, and when you do have interaction, you're wearing a mask, so you don't have the experience of seeing someone smile. So during the week at Parliament, we had to do all our meetings up there with masks on, well, we had to be in the public areas with masks on, and I had to adjust to not having facial cues in the way that I'm used to having. So you in Melbourne are probably quite used to this. It hasn't been our experience so much up here, but getting a coffee at the cafe and sort of smiling and then realizing that they don't see the smile. So wondering, should I do something with my eyes? I don't know.
It's, you know what, it actually gives you license a little bit, I think, the mask as well, just to relax a little bit, because you don't have to, like I think throughout the day, people smile because they are being polite, but they don't always smile, obviously, because they're happy. They're just being polite. So if you're wearing the mask, you can actually just relax a bit and not worry so much, because people are watching you all the time.
Yeah, actually, one of my colleagues said to me that maybe some people would find wearing the mask in some circumstances a bit liberating, because if they have confidence issues in some social interactions or being in meetings, and that they don't feel as observed. I don't know, but I thought that was an interesting point.
I was going to just comment on a couple of those things too, because I think they're some really interesting points. So I think, yes, in terms of this assumption that Corona has negatively impacted everyone's mental health, I think that probably is not true, because like you were saying, Cam, there are some people who really prefer it. And I've had sort of people say to me things like, this makes my life easier. Because it's basically, for some people, it's like state-sanctioned avoidance, isn't it? It's like I don't have to say no to plans. I don't have to go to the supermarket and get annoyed by people. But what I would say is, are those people doing better, or are they doing easier? So someone with agoraphobia or potentially a post-traumatic stress disorder, and one of their coping strategies is avoidance, this is a lot easier for them. But I guess down the track, when it does reopen again, what we know is the longer you avoid something, right, the harder it is to get back into.
Yeah.
So I think that some people are doing it easier, but maybe not necessarily better. Some people are doing better, and some people obviously are doing worse. It's a continuum, clearly, like a lot of things. And then, with masks, I think that's interesting as well, because there's such a variety of reactions. So yes, some people can hide their resting bitch face, I suppose, and it might be good for them. But other people, because they can't read the faces, if they're a fearful person potentially, or they've had an abuse history or something like that, they're thinking everyone looks scary, because how do I pick up if this person is, going to harm me in some way? I can't quite do it. Practically for us in therapy, I mean, in this country, we're not used to providing healthcare wearing a mask generally, unlike in, I think, other cultures where mask wearing is common, which I think Adrian might have spoken about in one of your other episodes. But there's sort of guidelines coming out sort of saying, be mindful that without the usual social cues, you'll need to use, I find myself using more gestures, using the eyes, because I don't have a naturally expressive face, but it's usually enough. But with the mask on top, I'm very aware of really trying to communicate, knowing half your face is covered.
So Ramsay, can I ask you, in your experience, in your practice, are you conducting tele sessions, sessions with patients on Zoom or the equivalent? And then with those, people don't have to wear masks, right?
That's correct. So that's been one advantage of the telehealth as well. So telehealth being either over video conferencing or telephone. And that's been, you don't have to wear a mask for that, because the risks aren't there. But that's also been an interesting one. Some people don't really like it, and they'll say, oh, wait, I'd rather prefer see face to face. But a lot of people love it. They love the convenience. They don't have to drive. There's no commute. Once we finish the session, already at home, and they can start cooking dinner. They don't have to worry about the logistics of it. And so that's been interesting to see.
And they're in their own home,
a lot of telehealth. Exactly, they're in a comfortable, hopefully safe environment. But yes, we were only allowed to. Oh, go on, Nick.
Sorry. No, you go. Sorry, I was interrupting.
I was going to say, well, what happened was when things first escalated, we weren't allowed really to provide face-to-face. We had to be much. And so there was this huge movement to telehealth. And then I think what happened was everyone started to realize that it kind of works really well, and it's kind of good. And maybe, is it possible to keep doing this? People would ask me. And so, and that's really, that's really tied into the Medicare system in a lot of ways, though. Not to go into the weeds about it, basically a lot of us, a lot of people come to see us under a Medicare mental health care plan, which means you can get a rebate for some of the money from your session. And some of the recent changes have enabled people to use telehealth for that purpose, whereas previously they couldn't.
Yeah.
That's been important as well. And also going back to your discussion of how topical and how important mental health has been recognised. Yes, there was in Victoria we had the Royal Commission into mental health system, but also recently the expansion of that what's called the Better Access program. So prior to the pandemic, people could get a maximum of 10 psychology sessions under that Medicare plan to get rebates, and that's now been doubled to 20.
Is that per year, or is that like, what's the
per calendar year?
Okay, yeah, wow. Okay, that's quite a lot, isn't it?
Yeah. Well, 10 often isn't enough
Yeah.
for the more complex or severe presentations. And especially if you're working with someone who finds it hard to build trust, etc. 10 sessions sounds like a lot, but it's not really. Or if they have 2 potential crises in a year, and they've used all their sessions with the first one, they're kind of stuck unless they can afford to pay for it.
Yeah.
Which some people can, and that's okay. But I guess the majority of people can't always afford it.
Yeah.
Ramsay, what's out of interest? What do you think? Because obviously, there's lots of reasons why you can come to see a psychologist, and so there's putting aside the more extreme things like, let's say, it might be someone with schizophrenia, for example, where it's quite a unique sort of problem. Just for the sort of more general population who don't necessarily have like some sort of some sort of genetic or some sort of issue around something unique or foreign, but something more like a general thing like anxiety or depression. What do you reckon is the underlying cause to a lot of them? Like, when you talk to them, is it very much individual, or is it there's some common suspects that always pop up?
Yeah, I think that's a really big question, isn't it? What sort of causes people to experience these changes in their thinking and feeling and behaviour? And so, yeah, I wouldn't say there's a particularly common single kind of factor. I think let's be consistent with the research too, isn't it? That we know that it's a combination of nature and nurture. It's not which one anymore. And so you're always looking for biological or genetic susceptibility, but there's no single genes that I'm aware of that are connected to particular mental illnesses. Some might increase the likelihood, but they're not single gene transmission like Huntington's disease, for instance. There's a specific gene. And that's consistent with I think what the evidence says. So it is that combination. And so, but again, one or the other isn't usually enough. So you might have all the genetic susceptibility, but if the environment in which you're raised and the relationships around you and life circumstances are all positive and helpful, you're likely not to develop that, and vice versa. So, yeah, a lot of people will talk about specific life events, but often there are background factors and historical factors that we can uncover and connect to the present problems. So often I'll talk to people about that.
How much of it is, because I know, it's a complicated thing, right? Because people compare themselves with other people around them as well. So they'll think to themselves, I'm going through something really bad here, not realizing that other people are walking around with, other people are suffering. Like, in other words, everyone suffers all the time. Some people suffer a lot more than others. And I wonder to what extent people put a lot of pressure on themselves, thinking that they're going through something terrible, and it makes them feel even worse because their frame of reference is inaccurate. Like, they walk around thinking, I should never feel sad, and then because they have that sort of belief, it actually makes them feel sadder. If you know what I mean, reinforces the feeling, and because they're trying to push it down.
Yeah. So I think, probably, yes, there is that for sure. I think that is part of it, but I think it's probably the opposite that causes more distress in my experience, which is people thinking they have no reason to feel this way, or people feeling that their problems are not actually significant because look how bad that person has it, if that makes sense. So I would I guess a useful concept around this area for me would be the difference between using comparison for perspective taking and kind of that sort of thing versus using comparison to dismiss or invalidate or minimize your own problems. So the analogy, if I may just talk for a bit here, the analogy I would use for this was, say you're out for an evening when we're allowed to do that, and you slip off the curb and you dislocate your ankle, right? And so you go to the emergency department. That would be the normal thing to do. And you're sitting there, it would hurt a lot because you've got a dislocated ankle. That's a very painful condition. So if you're sitting there, and then as you're sitting there, someone else comes in and they're missing the entire lower part of their leg from a car accident or something like that. You would look at that person, and then someone else comes in and they're a double amputee in a wheelchair, right? They've got no legs. So using comparison for perspective and gratitude would be something like, oh, gee, I know what I've got's really sore and painful and bad, but I can be grateful I can come to, I live in a country where I can get free healthcare. I can turn up here and get looked after. And as bad as this is, at least I've still got my legs and I know I can get over this. But minimizing would be, you know, I've got no right to complain about my sore ankle. I'm wasting everyone's time. I shouldn't be here. It's not that bad, which is flawed logic, isn't it? Because no matter how bad someone else has got it, you still need care and treatment for your dislocated ankle.
Yeah, it's funny. So it's
it doesn't make it any less painful or real just because someone's got a more significant injury.
Yeah, it's you always get in trouble, I think, with like friends or loved ones if you try and convince them that they're okay with something. Like, for instance, if someone's got a bad cold and if someone says to you, oh, you're not dying, it doesn't make you feel any better, does it?
No.
I'm not allowed to do that again, Nick.
and here's the secret, they already know that.
Yeah.
You know, so
it goes back to your upbringing, I think, too. Like,
yeah, that's right. What you believe.
Yeah, the way we have a saying in my family, like, we're never sick, we're either like perfectly well or we're dead. Like when I was sort of growing up, if someone had the sniffles, it was almost like you could walk it off or, you know, sort of get over it. And I don't like that. I don't think that's the best way to handle things personally.
Well, it's probably a balance, isn't it? Because that comes into resilience and hardiness and pushing through.
Yeah.
But I think the idea that if you can't or don't, you somehow failed or are weak is a problem.
Yeah.
Or when you actually do need to take time out. A lot of people that I work with, they it's only when they stop and we go through everything that they've been doing, it's like, oh wow, okay, no wonder I sort of broke a little bit, because they've just been pushing so hard and trying to push through rather than taking a break where it's needed or doing something else to prevent it.
Yeah.
And so it is that delicate balance.
Yeah, I find that in just like with workplace consulting, sometimes there's that similar thing, right? But with not about emotional issues, but like we'll go, let's walk through some process that we've been doing for many years. And sometimes people will talk through the way the workplace operates, and they'll almost start laughing at some of the things. They'll go, oh, we do this. I'm not really sure why we do that. And then they're almost like when they slow down to actually look at some of the things that are happening that have just evolved organically over time, it can often be very messy. And I think when you get back to the root cause, the human beings are a bit like that. We don't plan everything out properly. We kind of just act on instinct. And then over time, we develop these weird habits. And the next thing you know, you look back and you go, I've just been doing this for 3 years. I've been doing it for 10 years. And you never stop. And if you don't actually stop and actually analyze it and look at it, then you would just keep doing it.
Yeah. Yeah. In terms of why you do it, absolutely. That was often my experience in government working with the public service, not to go off on too much of a tangent, but I'd ask why things were done in a certain way. And I was told that was sort of the protocol or something like that. And if I was trying to ask, yes, but why? I couldn't really get an answer. It was often just, that's the way it had been done.
Ramsay, out of interest as well, like, so there's obviously, you know, there can be traps that people fall into, like if you like say OCD type traps where people, you know, have these sort of, they might have a thought that they might wash their hands, for example, and then that might reduce their anxiety temporarily. And they probably don't realize that, that's what's happening, that every time I do this, I reinforce this kind of connection between the anxiety and the activity. And then over time, that connection becomes hardwired so much that it's very hard to break. So there's traps like that, which you can understand a psychologist would be really handy to come in and say, all right, this is what we've got to do. This is a pretty tricky problem, but we can follow a process and get through this. And then there's other issues that people have which are not very specific like that. So there might be something like somebody's just like may have not pursued their interest or their things that they really value, and they actually might be feeling depressed or dejected, not because they've got some mental health issue, but rather because their brain is almost telling them, hey, you're not doing what you really should be doing. You know, you should be pursuing your interests. You should be trying to go out on a date with that person that you're in love with, but you're not doing those things. And therefore, of course, you're going to feel pain and suffering. And that's actually almost like a motivator to tell them that they have to take some risks and do something different. Is that a good, I mean, I'm always interested, like, to what extent are you dealing with people with potentially who need some help kind of navigating through life versus a specific, you know, issue that actually is like a habit or like some sort of, you know, I guess what we traditionally call some sort of mental illness, you know, like, or are they all kind of mixed in together and you have to untangle both?
Yeah, a good question. I think part of that is the context in which you're working. So as a clinical psychologist, seeing people who are usually coming through their GP as a first point of call, by definition, if they've got a mental health care plan, they need to have a mental health diagnosis. So that kind of is a bit of a population bias, I guess, in terms of who you might see. However, some people do come privately, and if someone wants to come and see you privately, as in not through that system, yes, then you're more likely to see people who are maybe identity issues or kind of feeling a bit lost or have lost their meaning or that sort of thing, but wouldn't necessarily tick the boxes for, you know, a diagnosable mental illness or mental health problem. And in those cases, yeah, I think what you're talking about, I mean, there's so many different, I guess, evidence-based therapies that we draw on, which is the classic word you'll probably hear from a lot of psychologists is eclectic, which some people take as code for, you know, bits and pieces of everything all over the place. But the way I think of that is it's not. Eclecticism is the ability to draw on a variety of evidence-based therapies and match them to what's in front of you. So that's what I would say that is. And so what you were referencing there is very closely aligned with, and I think again, Adrian mentioned this, with the acceptance and commitment therapy approach, which is actually where what you're doing, the bigger the gap between what you're actually doing and what your deepest values and what means the most to you are, the bigger that gap is, the more uncomfortable you'll feel. And so the idea is to realign yourself with meaning rather than goals. So for instance, you might have a goal to get married, for instance. I don't know, say that's your goal. Always wanted to get married. However, the type of partner you are day to day is going to be guided by values. So you might want to be an honest, reliable, trustworthy, caring partner. And there are things you can do every day to bring you closer in line with that value, even though the goal is already achieved, for instance. Yeah. So,
So, and I think that makes sense. I mean, there's like kind of like psychological and social issues are more complex than sometimes, you know, like medical problems where you can actually see like a problem, like you can visualize, you can run a blood sample and get a diagnosis. So you've got to kind of piece together evidence and then connect it. And then sometimes I imagine you probably have to experiment as well, like this might work or might not, and want to try something else.
Yes, yeah, and that's where it's important to generate, I guess, what we call the formulation, or which is basically what is it that's caused this problem to arise, what factors are involved, and which ones are we going to target using what therapy.
Do you think, which is with the pandemic, are we going to run the risk of increase in OCD?
It's possible. It is possible because, again, it's almost that state-sanctioned idea of it, isn't it? You know.
Are we going to change our definition of what it is? I mean, I'm washing my hands like 20 times a day now. So you might have told me 12 months ago that was an obsessive behavior, and now it's a state encouraged behavior, right?
Yeah. So remember, with something like OCD, though, you've got to have the distress involved. And so for most people, washing their hands it's not because of it's not causing a marked impairment, right? You're just doing what you're supposed to do to not get sick. So yes, I think changing criteria is notoriously difficult and can be political, I believe. But probably need to get into that. But yeah, I think it's probably likely to exacerbate people with that condition already, but also general health anxiety as well. But I think as well, just to get back to just to get back to your question though, about also how you work with people. One really big part of it is the relationship. So there's some really good evidence and some great ideas around. It's not necessarily only the type of therapy or approach that you're using. It's actually, regardless of what approach you use, if the relationship is solid, the therapeutic alliance, we call that. So the ability to relate to that person and for them to feel heard and safe and connected, all those things. If you've got a good fit and your relationship is strong, that's being increasingly focused on as a key component of any intervention for any mental health problem, really.
That just quickly, that goes to a question I was going to ask. Like last week in the episode, we were talking about consulting, like the experience of being a consultant. And sometimes in the experience of being a consultant, you have to give your client information, advice, assessment, call it what you will, that they don't like or they're not comfortable with, or it's confronting. I imagine in a broad way, at least, that might translate to what you do. You operate in a confidential environment, obviously. So I imagine for the patient, that can be very liberating, because they know that anything that's sort of said in that room will stay in that room. And why it's not necessarily your job to give them advice, I suppose, although maybe it can be on occasion. You're going to necessarily deal with things that are, very personal to the person, uncomfortable for them, difficult for them to deal with. Like, can that frustration ever be projected onto the therapist? And like, how do you deal with that? Is that part of having that strong, relationship?
Yeah, great question. So yes, I think like you said, definitely confidentiality is the underpinning of the entire operation, really. It's so important, and that trust that goes with that. So in terms of that, yeah, often, my style is definitely a non-directive style. That's the way I was trained. I know there are different styles out there that are more, directive, but really we're seeking to help the person come to their own conclusion that ultimately benefits them in some way. And so you might be asking questions like, and what have you noticed when you do that? Or, how do you make sense of why these things keep happening in your interpersonal relationships? What could that be about, And then empathic challenging or empathic confrontation, we would call, I think, what you're saying. So empathic confrontation is really pointing out something that someone's doing that's causing them an issue, or others, in a way that's not punitive or judgmental.
Yeah.
And so, yes, depending on the person, sometimes you need to assert your own boundaries. So I might say something like, Cameron, I can see that you're really angry right now, but when you yell at me, I feel uncomfortable and a bit unsafe. So you might actually assert your own boundary with someone and challenge that behavior in the moment.
Yeah.
Or you might say that if someone says something about maybe they're being violent to a partner or another person and trying to justify it, then our role is to challenge that and say, challenge those distorted beliefs that gives people the justification that they can do something harmful. And so, I don't know if that answers your question, but I think that's a couple of things.
Thank you.
Ramsay, do you, I know you can't prescribe medication, that's a psychiatrist or a medical doctor does that, but do you find yourself recommending that they go and talk to their GP to get antidepressants? Is that something you support?
Yeah, I think this is a really important issue. I think as in my role, it's really important not to be pro or anti-medication sort of thing, but give people the facts and the evidence, really. And fortunately, as I'm also a forensic psychologist, so I had a lot of exposure to people and medication and treatment and multidisciplinary approaches. So I try to bring that into the clinical private realm. So what we know, say for depression, right? Let's imagine a continuum. You've got mild at one end and sort of severe at another, in the middle. So what the evidence shows is that sort of for mild symptoms of depression, it might not even be a major depressive illness, but enough symptoms to cause a bit of difficulty. Talking therapy is probably all that's required. Seems to be enough benefit. When you get to the severe, so these are people who are not showering, not getting out of bed, at risk of suicide. We know that medication is needed usually in a lot of those situations, so the person can actually do the talking work. Because if you can imagine someone's cognition and ability to engage and the energy levels are not there, you don't have a window, you're not going to be talking to them about their childhood and, doing this and doing that, because it's just not at that level.
So it's basically, it's like a circuit breaker so that you can get movement down.
It
can be.
That's right. And just, and if I feel like someone may benefit, what I might say to them is for these reasons, you might benefit from a psychiatric review, which you can get through a GP, for instance. I'll give them the reasons, and most people, some people are very anti-medication as well. They might come in and say, I'm never taking any medication because I don't trust big pharma, or I don't know what it does to my body, etc., etc. And so in that case, our role isn't to say, get into a big debate about you should take it. What you would do is you would validate that approach and say, I hear what you're saying, and it's not my role to tell you what you should do. But then you might sort of gently guide them through, but what we know is you've told me this, and go through that and get them to maybe realize that potentially the benefits of taking it might outweigh the benefits of not, for instance. And that, I guess the other thing, I don't know if I can't recall if we answered did we go over the suicide rate question at the start, or did I get sidetracked?
No, I don't. We touched on it obviously, but I don't think you sort of responded to it fully. So let's talk about that.
I just wanted to respond. I don't think I did. So the risk of sidetracking, I just wanted to come back before I forgot. So what there was in August, what happened was that this is Victoria only. So there hasn't been any increase, basically. So what happened was the coroner released the suicide or death by suicide numbers in August. So obviously it's a bit of a lag, but still, that was from the start of the year to around August, and found no discernible increase in number at all. It's good news in a way. But what the concern is from other people responding to that was that, yes, that's for now, but what we're looking at is in the future, what's going to happen. Things like economic ruin, those sorts of things. Are they going to start hitting harder once job seeker, for instance, is removed, etc., these sorts of things, or once jobs start getting lost or whatever it might be, or as mental health conditions get more entrenched and severe. So, but yes, there was this thing floating around about suicide rates have gone up 200% and things like that, which in Victoria, is all I'm talking about. That's not true. They haven't gone up. They hadn't gone up at that point, at least. But what has gone up is help seeking though. So calls to support lines, presentations at hospitals. Okay. I think those things have gone up, but the number of deaths by suicide hasn't.
Do you know when the coroner releases that information? Like, will we have another set of figures at the end of the year, or is there a schedule with that sort of thing?
Yeah, my understanding, and I could be wrong on this, so people out there will be, who know this stuff, hopefully aren't too angry at me for this, but I think it's an annual release from the year before.
So it could be waiting some time.
Yeah, but what he's done this year, I believe this was a release earlier than usual to allay those fears. So he took the step of releasing figures to date because of the concern in the community about the increase. He may do that again at the end of the year.
I worked in the defence space, as I've mentioned on this podcast, as a civilian in government, and there was a lot of controversy for a while because of they didn't release suicide figures of veterans and personnel sort of for a long time, and now they do. So that's sort of an aside there.
Yeah. Well, I work with some people who are either still in defence or through Department of Veteran Affairs as well. So I do clinical work with that population, and having a look into that situation. It's really quite terrible, really, the way that that overrepresentation in that population. And I think there's stuff being looked at into that, isn't there?
There is, there is, and it's a whole other conversation. But they're getting better at that kind of support. But they've started from a pretty low base.
I think the
Yeah.
challenge with looking at figures as well is, and I know this from like in working in like road safety, was you could have a year where say the road deaths were about the same as the previous year, and you start to say, to what extent were all the road safety initiatives effective then? But then people would say, but maybe if we hadn't had them, then we would have had another 100. And so you don't know for sure. So you could argue both sides, right? You could say maybe the suicides would have been a lot lower this year, for example. Like we didn't know if it was going to go down, but we also didn't know if it was going to go up as well by arguing the same argument. So the problem I think always comes down to, which it isn't really discussed in the mainstream, is that we quite often don't have any sort of really good control groups to really have a firm conclusion on any of these things. And I imagine that probably the best in a study will be if you can look at, say, the rates and compare them across states within Australia, and actually see whether rates actually changed in that period of time relative to the other states. I'd also imagine that one of the other problems with suicide is that it's not really like the numbers are too high, as in, that we don't want to have people killing themselves at all. But they're not particularly high in that we're going to see, tens of thousands of people suddenly kill themselves every month. It just doesn't. It's not something that perhaps is that sensitive that it's going to suddenly shoot up. And so we're not dealing. So I think what you were talking about, Ramsay, before was really important. It's like it isn't. Look, suicide's one thing. If it gets to that point, that's really extreme and it's really terrible. But there's actually all these other things, such as distress and people's quality of life and their worries for the future, which are also very concerning. So if people are contacting psychologists and they're really concerned and they're worried about their future, they're worried about their livelihoods, then it's a horrible thing to think that there are people sitting around now in much greater numbers feeling terrible distress and worry. I think that's something that we need to worry about. It's if anything, that's as worrying perhaps as suicide. We don't want people to be in those situations, and we don't want them to be feeling like their life is like kind of hopeless because they can't sort of go off and work or whatever it might be, or see their mothers and fathers.
And a question for Ramsay maybe tapped on. Yeah. Sorry, I spoke over you, Nick. You dropped out for a second. I was just going to ask Ramsay, sort of following on from that, like suicide is not a natural progression necessarily from, I guess, even depression or feeling in a great state of distress. Like there's some people who experience great anxiety, even debilitating depression, but not necessarily feel suicidal, right? They can be different things. Is that correct?
Yeah. And look, I'm not a suicidologist, so I've got to put that caveat on there that it's not my main involvement with my research and things in the past hasn't been around suicide. But yes, you're right. Mental illness is not it's not a fait accompli into anyone's life. What it is though is a significant risk factor.
Yes. Yeah.
I'll put it that way.
Yeah.
And so, there's a lot of things that can go into it. Obviously, I think from the figures that I was looking at here, last year we had, 718 suicides in Victoria. And they also referenced that men are 3 times more likely to take their own lives in these up-to-date figures, with 350 so far this year. So being male is a risk factor, but that doesn't mean that females don't also end their lives. So it's a bunch of risk factors that usually coalesce, one of which is mental illness. But we certainly don't want people thinking that, yes, if you are suffering a mental illness, there's no other option, or that you can't get better, because people do get better. And like truly better. Like you can be not depressed anymore, even if you've been depressed. Or you can not have generalized anxiety disorder anymore, or OCD anymore.
Do you think that gets lost in the conversation a bit? The fact that people can get better, that can recover, like can go on to live a life without depression or anxiety?
Yeah. I think that's where the whole, maybe that positive psychology side of things comes in, doesn't it? That idea of thriving and optimizing and improving. So you can move from one end of that spectrum of mental ill health through to wellness, and then through to flourishing and thriving. and back again, of course. I mean, movement can happen. People can relapse. That's true. We know that if you've been depressed before, you do have a sort of probability of getting depressed in the future, and that goes up the more times you have a major depressive episode. But not everyone has recurring episodes, for instance. And so, yeah, I think the positive psychology movement is trying to tap into that idea that you can remove your symptoms, but not just that, you can also flourish and thrive by focusing on what's working well and what you can do better. But yeah, recovery is definitely possible. We know that. And for those more chronic entrenched illnesses, maybe total remission or not meeting the criteria anymore might not be possible, but you can still have a very valuable, meaningful life and contribute, and all those things are still possible as well.
Do you see patients dealing with grief, or is that generally a separate area of therapy?
No, I'm quite interested in that area as well. So grief, I guess, going back to what I was saying, those pathways, some sort of major incident, grief would be part of that pathway. Yeah. And so I think we're very careful, at least I am very careful, is this fine line between pathologizing what's a normal response.
Yeah.
Versus
that's very interesting.
It is, versus what might be some sort of complicated grief or depression with grief, for instance.
Yeah, because we do have these sort of societal expectations on what grief should look like, and maybe how I should be feeling about something that's happened versus the way I really am feeling.
Yeah, I think that was what I was getting at before. I think that's a good way of describing it, pathologizing normal responses to life, I suppose, which is it gets to a tipping point, I guess, where there's enough distress where it's no longer normal, and normal in the sense of normal. And I guess there's if you go through a list of things that if you're not pursuing things that you're interested in, or if you're not actually leading a meaningful life, then obviously that could be because you've got some mental health issue that's blocking you from doing it. But it could also be that, you've actually just made some bad choices, and you need some help to, get yourself on the right track again, which, before psychologists were around, people probably spoke to mentors and friends and family and would get through those sorts of problems.
That's an interesting aside. Just before psychologists were around, maybe we weren't doing therapy, maybe we were getting support in different ways. But Ramsay, how much these days is what you do? And I'm not trying to make it sound at all negative here, but because some other outlets of support aren't necessarily available to people. So they, I can go and talk to my best friend and sort of talk about my problems and get advice, but maybe my best friend is going to be, it's coming from the right place. He's going to want to be really supportive, right? And tell me kind of what I want to hear, rather than, an objective kind of view.
Yeah. Look, it'd be very, very difficult to comment on the proportion of people who come to us because they no longer go to others. I mean, that's pretty difficult.
We want to hear an exact proportion, please. 20%, 50%.
I had to narrow it down. Probably somewhere between 0 and 100%.
Yeah, good.
But I think there are 2 points there. So just to go back to the normal, what you were saying about normal, Nick. So if you think about normality, I mean, we've got statistical normal, we've got cultural norm, there's different types of normal. And so I think that's just worth noting. But in terms of, people seeking support from other people, very important. But a lot of people will say to me, one thing they value about the space in therapy is that I have no emotional investment or knowledge of the other people involved potentially. Because a lot of the work is around struggles in interpersonal relationships or effects on others or how others are affecting them. And so because I'm sort of removed from that, people do find that they get something different from that conversation than potentially with a sister or best friend or whoever. Doesn't mean that it's better necessarily, but it is different. And obviously I'm coming from a certain lens and certain training and certain biases that I try to be aware of and all that sort of thing. So psychologists are certainly we're not pretending to be perfect, I think is important too. Because we're not. Sometimes what we do doesn't work as best as we try, and that's sometimes what happens.
I know I was going to say, I know you can't discuss your patients, obviously, we wouldn't ask you to, but it suddenly crossed my mind like an interesting, almost like a sitcom storyline might be a hairdresser who goes into therapy because their clients, you know, who they're cutting the hair of, are just pouring out all their problems to them, and this becomes like weighs down on them so much that they themselves have to go into therapy and sort of sort that out. And I know, like, well, so I know certainly I've heard of some psychiatrists who end up going into therapy themselves because of their, you know, their own experience weighs down on them. But yeah.
Yeah, the hairdresser is definitely sort of known, isn't it, as the unofficial counselor or unofficial psychologist.
Yeah.
Which is interesting because yeah, I don't know. I wonder how realistic that is, or if that's sort of biased some way towards the people who sort of make it known that that's what happens versus the reality. Because I don't know about. I mean, do you guys have in-depth conversations with your hairdressers?
I have a barber, which might surprise people because I'm basically bald, but I like to keep it short. And I go and see this guy, and it's a really safe space, actually. So it's I don't know if we have in-depth conversations exactly, but yeah, we reflect on all kinds of things, including our childhoods and this and that. And I've been seeing the same barber for a number of years now, and I'm not telling you my deepest, darkest secrets, but yeah, we open up to each other a bit.
Yeah, I do a little bit. Yeah, I think it's tricky if you're if you go to like a hairdresser and there's lots of other people getting their hair cut. The last thing you want to be doing is talking about all your emotional traumas. Actually, I used to have a hairdresser, not the one I've got currently, but it was probably 2 hairdressers ago.
Nick has magnificent hair, by the way, for those people who can't see it. Right.
Well, it's not at the moment because I haven't had it cut since the start of the lockdown. I've been pushing it back with lots of product. But this guy he'd cut my hair, but it would almost actually be the other way around. He would talk about all of his problems, and including at one point he was very frustrated with the owner of the hairdresser who was working there at the same time, and he would complain and say, "Oh, I wanted to take a day off today, but he wouldn't let me, and I'm really annoyed today." And I'd be sitting there feeling very uncomfortable and also a bit worried that the owner would overhear the conversation as well.
There's a real power imbalance here, because if someone is sort of pouring their heart out to you and they have a pair of scissors or a razor and, you know, they're hovering around your head, you don't want to get them offside.
Yeah, that's right. I was worried for you, Nick, about maybe he formed the conclusion that the only way for him to get a day off was to be told to leave after a particularly accidental haircut ended up in a cut or
or just gave me such a bad haircut that I complained, and then that's right. Yeah, no, but he'd come in, and every time it would be it was that, and then he'd talk about his relationships and yeah, so I guess it did get to the point where it became convenient for me to see the same person, because, you know, you get into that habit. But then eventually I moved on, and I found it a lot better to actually sit there with someone who was actually just focused on just cutting your hair rather than.
Do you think that he was focusing all this sort of angst and almost confession onto you, or was this happening to every person sitting in his chair? Like, because if he was doing it every time, that would be exhausting for him, surely.
Well, you know what's interesting? It could also be, I think sometimes you tell people you're a psychologist, and they actually do either. There can be 2 reactions. One is that sometimes people get a little bit uncomfortable, and other times they want to talk, and they want to talk about their problems and stuff as well. Not as much as before, but I think sometimes you talk about psychology and the stuff, and people kind of go, "Oh, wow," and then they start asking all sorts of questions, and then it turns into, "Oh, well, I've actually got this interesting problem right now. I've got this my partner's doing this," and I imagine Ramsay probably has similar experiences.
I was going to ask that, like, so what do you both do if you get into an Uber or something and you get talking to the driver and they ask you what you do? Do you tell them, like Nick and Ramsay, or what?
Mine's trickier than Ramsay's, because if I say I'm a psychologist, as I was saying before, people think as a therapist, and then I have to give a whole backstory to what I do, and it's hard to explain what I do. But yeah, if someone says, the classic line is, "Are you reading my mind right now? Are you analyzing my behavior right now?" And the only response is yes.
Yeah. And what about you, Ramsay?
Yes, the only appropriate response is yes. No, it depends. It depends what I want interaction is. Because if I'm up for a conversation, or I'm feeling particularly talkative, I'll go into it. But if I'm not, I won't really engage in it too much. I'll just say, I work in mental health, you know.
Yeah.
And because sometimes, especially like if you've had a massive week or day of seeing a lot of clients or this or that, sometimes you're all talked out, to be honest.
I made the mistake once of getting into a cab at Canberra Airport and someone asking me where I worked, and I said Parliament House because that's where I was working at the time, and was sort of just subjected to a tirade about how every politician in the country is corrupt and the whole system's broken. And then I started making up various things, like I blow up bridges for a living or something like that. But then that can like kind of back you into other corners too, because people might start asking you quite specific questions about that. So
well, Nick, I was just going to change tack slightly back to something you were talking about too that's probably worth noting, was this idea of sort of good and bad emotions, because I think you're talking about sort of not pathologizing the normal range of human experience. And I guess this is one area where there's a bit of a difference. I know sort of positive psychology does talk a bit about good emotions, so create more good emotions and try and minimize the bad ones, not suppress them necessarily, but I guess the language there is there are different points of view around that, because another way of looking at it is that some emotions feel bad and some emotions feel good, but in and of themselves they're neither good nor bad, because that's a judgment label attached that doesn't really reflect potentially the breadth of human experience, which is sadness is normal, anxiety is helpful and normal. You know, it's not a bad emotion. And anger, again, it's not necessarily a bad emotion. It actually can motivate you to stand up for yourself or right or wrong, for instance. But if it leads to unhelpful behavior, so punching someone or committing violence, it's not that anger is a bad emotion, because sometimes when people get angry, they do bad things. It's that the behavior that's being driven by that emotion is not good.
Yeah.
And I don't know what you think of that, or whether do you think there's a general perception that there are good emotions and bad emotions, or is this semantics, or do you think it's important?
Yeah, I completely agree with everything you're saying there. I think that that's why I'm not a big fan of positive psychology, like just some of the things, but I do like some of the things that it pushes. One of them is, I think that for too long, psychology has been the domain of mental health and distress, when really psychology is much broader than just people having troubles. So, and I think it put the spotlight on some other things that we could use it for, and I think that's quite positive. I don't think the true positive psychologists will say we've got to suppress depression, anxiety, those problems. But I do think there is a danger with it, where the message is sent that people go, oh, right, so we've got to be more positive all the time. And I think we've got this, we can't always be more positive, because to make progress, we've got to go through pain and suffering, and we've also got to acknowledge where we've got failures and issues. So I'm just thinking, like, we all go through experiences where, like, it might be, let's say you wake up on Monday morning, it's the start of the week. If you've gone to bed a bit late on Sunday, or if you've had, extra glass of wine you probably shouldn't have had, and if you wake up at wake up in the morning and you're feeling fatigued and flat and run down, then that is not, that's a normal thing, right? That's basically, hey, you didn't go to bed early, you shouldn't have had that extra wine, and it's the start of the week, so it's always it's hard to get mentally to switch on. So then that's your brain and your emotions saying to you, hey, you know what? You could actually change a few things and you won't feel like that. And that some of those things will be good for your health and good for your week. And I think it's good that if you're more self-aware about all those things, you're self-aware what that emotion's telling you, that it can be really useful. And I also think that, like, you have, there could be things like, if you have a fear of public speaking, which pretty much everyone does have, at least to a point. Some people don't worry too much about it at all, but everyone has a bit of anxiety talking in public. But if you spent your whole life avoiding it, then it basically just becomes like this big problem every time you have to do any sort of speech. Whereas, but the people who get much better at public speaking confront the fear quite early and practice and practice and practice. And they don't get rid of the anxiety, but they learn basically how to do it at the same time and just get on with it. And you wouldn't ever make any progress. You'd never do that if if you just thought to yourself, well, the best public speakers aren't worried and don't get anxiety. If you thought that, then you'd be like, oh, well, I guess I could never get up and do a presentation, or I could never be an actor. But there's, there's a famous actor, was it Laurence Olivier? And he used to like throw up before every big performance.
Yes.
Yeah.
Yeah.
And then there are plenty. I mean, in fact, I'd imagine almost not all of them, but many of those actors, famous actors, are very extremely self-conscious, and they probably are constantly beating themselves up over their performance and I'm never going to get another job again. That kind of attitude. They probably live in fear of doing that. They probably spend their whole life. Not all of them, but I'm imagining there'd be plenty who'd be like that.
Yeah.
Yeah, it'd be an interesting cohort to have a look into psychologically.
Oh yeah. Imagine doing therapy in Hollywood.
Oh yeah, absolutely, indeed. I think I like. I don't know if you guys ever watched what's it called again? Entourage. Did you ever watch Entourage?
Yeah, I watched that.
Yeah, there's a great character in it. I think it is Kevin Dillon. He plays Johnny Drama.
Yes.
Pretty much like the Robert Barone of the show, or
Yes.
the Butch Costanza of the show.
Yes.
And he spends pretty much every season just constantly beating himself up, always wanting to get these great roles, and he's in terrible anxiety, and he always fails the auditions and just has these terrible moments. But then occasionally has these wins, and when he shouts out, he goes, "Victory!"
Yeah, and he's very insecure, but he projects a sort of very cocky sort of exterior, doesn't he? Yeah,
that's right. And then when he has these wins, it's really uplifting for the show. You really love the character because you think,
you want him to win. Like, he can be pretty obnoxious and all that, but you do want him to win.
Yeah,
that's right.
He's like a classic overcompensator then. So he's overcompensating for his deep insecurity, isn't he, by putting on that front, but underneath it's very fragile, and that's not uncommon, is it? It's not.
Yeah, absolutely.
And I was thinking, just in terms of wins, going back to our poor old Robert Barone, there was that episode, I think, I can't remember the specifics, but it involved, Ray went with him, didn't he, on his police kind of rounds. He'd been making fun of him, this and that, putting him down, and then something happened where Robert kind of sprung into action and sort of saved the day from a criminal, and Raymond was just so like shocked and in awe and admiration of what he'd done. And that was an example.
Yeah, I think I saw that one.
Yep.
Actually.
Yeah, and that was another example of that, wasn't it? Where the character kind of gets a win and actually shows that he's got legitimate skills.
Yeah, and then maybe he's got a sort of a skill set or a set of strengths that he doesn't get to show off at home or on a daily basis. But when you're in his house, so to speak, he does that really, really well. And,
exactly right.
So just to wrap up, Ramsay, obviously we're coming out of lockdown in Victoria, but there's going to be this probably ongoing pandemic thing across the world. What's one piece of advice that's good? Do you reckon that's good for everyone to follow for their mental health? Do you think? What's one? If you do nothing else, do this thing. It'll always work.
Bring a little expectation on any.
I did the same thing to Adrian, I think you remember, and he didn't like being put on the spot with that.
Probably because we're so highly trained as to not make snap judgments and to adopt a one size fits all. So I'm going to cop out with this question. I'm going to say, I think the best thing each individual can do is be aware of where they're at and seek support if they need it, but also know what works for them. So if something works for you, do that thing. If something doesn't, put your energy into other things. But I know that's a bit of a cop-out answer because
no, that's a good one.
I think it's good advice.
Yeah, it is, because it's basically be self-aware, essentially.
Yeah, self-awareness, and that's right. And thinking about where you invest your energy. Try something out. And this whole just one thing I'm going to quickly touch on. I think this whole mindfulness and things like that has become a bit of a buzzword. But for some people, mindfulness, for them, it doesn't work or it's not helpful. That's actually okay. You don't have to force yourself to do mindfulness because lots of people say it works for them. If it doesn't work for you and you've tried it, legitimately giving it a go, for instance, and I'm not picking on mindfulness because I use it a lot with people, but if for you that's not working or it's not sort of giving you the benefit, there's no point continuing to try and force yourself into it. You're better off letting it go and finding something else and put your energy into that, I think.
Yeah.
That makes sense.
Well,
Yeah, I think so.
it sort of did, but you broke up a little bit at the end. I'm not sure if you read that, Cameron, but just right at the end. But
Oh, no,
I think,
that was when I came up. Right when I
you-
came up with the single answer.
yeah, no, I understand. Well, basically, what you're saying is you do what works for you, and don't put yourself under any sort of pressure to follow something for indefinitely, hoping that one day it'll somehow magically work. Basically, because it might not. It might
Yeah,
not
and
be
if it
right
doesn't,
for you.
yeah, and just because something doesn't work doesn't mean nothing will work.
Yeah,
Yeah.
so my advice is everybody should watch Everybody Loves Raymond for a few episodes, but don't watch the whole series. If you really are not enjoying it after 5 or 6 episodes, you're right. You don't have to keep watching it. You can actually stop. It's okay. But if you're watching Seinfeld, I do recommend you watch the whole thing until you get right to the end, because.
Yes. Yes.
All right, thanks,
Well,
Ramsay.
Thank you, Ramsay.
Thanks for joining us. Enjoy the long weekend in Victoria.
Yes.
Thank you. Thanks for having me. I hope that was it was really enjoyable. Maybe you can have me back. There's plenty more topics that I'd like to come up with.
May your team win
Absolutely.
unless it's Richmond.
Absolutely. No, we will. Thanks again. We'll enjoy the weekend, and we'll catch you on a future podcast.
Excellent. Thanks a lot.
Hopefully, look forward to it.
See you.
Bye. Okay, so we will wrap up now, Mr. Hawker. So we've already gone over lots of TV shows. I've already mentioned that. So, are you reading anything of interest?
Yeah. Do you know, this is terrible because I actually wanted to talk about a TV show.
Oh, okay, good. Go for it. Yeah, good. It's
Well,
not Everybody Loves Raymond, is it?
I will bring a book in the next week or next session maybe, but there's a show that's coming back on next week for the second season, The Mandalorian.
Oh, yeah.
I don't know if you saw the first season.
It was great.
Yeah,
Fantastic.
I thought you might have, because I know you're a bit of a Star Wars guy. So I really enjoyed it, and I came at it from. I mean, like, obviously I grew up with Star Wars, but I'm not a huge Star Wars nut. You know what I mean? So I'm definitely familiar with Star Wars and familiar with that reality and all that sort of thing. And let's face it, like, different franchises of Star Wars have been really great and others not so great. It's varied a lot in its sort of consistency and quality. But I found The Mandalorian really, really engaging, and just as a story in its own right, but also the way it connects to that broader Star Wars universe. And I think it's something that, really, if you had no knowledge of Star Wars, you could sit down and watch Mandalorian season 1 and still get a lot out of it. You get more out of it. Like, it is baby Yoda, obviously. So, almost everyone, even if they're not overly familiar with Star Wars, sort of knows who Yoda is, and that sort of like figure of Yoda is familiar to them. I read up on it. It's described as a sci-fi Western or a space Western, which I thought was really interesting, and I picked up that early on. It's got some really tropes of the Western.
Well, that was the original Star Wars, was basically had the tropes of the Western as well.
Yeah,
Han Solo is a cowboy, really.
Yeah, that's quite right, actually. So you saw it as well, the first season?
Yeah, I thought it was great, and I think what I think worked well, which has probably been missing from a lot of these fantasy type shows and movies for a long time, has been really simple narratives and stories and characters, so that I think we've kind of had a feast of shows like Game of Thrones with lots of subplots and characters, and then there's all the big Marvel movies which have interrelating plots and massive special effects. Whereas I think this one is very much as you said, more like a Western, and it's got, the pace is a little bit slower, and nice self-contained stories. It doesn't try and overdo it.
Yeah, that's right. And so there's a quest, obviously, which is always a good, it should be a good basis for a story if you do it properly. And then it is episodes are self-contained, though, I suppose. They have their own arc and that sort of thing. And it's really beautifully put together, like beautifully filmed and all that sort of thing. And so I'm pretty excited about it coming back on Disney Plus, I think on the 30th of October. So I think Disney releases, they just drop the whole thing at once to do. I can't remember. I think they do.
No,
It'll go bit by bit.
One episode at a time.
Yeah.
No, I think that is good. I've got I've got a newfound, and it's a really embarrassing guilty pleasure, which is I actually have now come to appreciate the George Lucas Star Wars prequels.
Oh, what an interesting one that you've got that on your list today when we're talking about Mandalorian.
Well, I think it was mainly because the Star Wars sequels, they call them, the most recent ones that came out. I really don't like them much at all, and I was sort of reflecting more on the old prequels and sometimes flick some scenes on and stuff, and as cheesy and as and some of the acting.
But you're talking about the original movies?
No, the originals. Everyone thinks they're classic.
Yeah, so you're talking about the ones that were made like in the early 2000s, right?
Yeah, that's right.
Yeah, I know the ones. Yeah.
Yeah, well, I think because I like kind of look at it as I appreciate the imagination now, because I think that those prequels kind of were well building, like they created new planets and it was much more sophisticated, and I think that the sequels that came out recently very much kind of tried to return to the original, and I don't think that they brought anything new to the table, and they replicated.
What about Rogue One? What did you think of Rogue One?
I think it's entertaining, but again, I think it's shot well. But I think the biggest problem with that movie, even though I enjoyed it, is I don't think any of the characters were memorable or interesting. I think, with the exception of maybe one, the character who is like he's kind of carries the staff and he's blind and he beats up all the stormtroopers.
I probably agree with that. I think I might have enjoyed it more than you, but I'd agree with that. Like, in a way, all those characters have to be disposable. Because without giving
I know, that's right.
away, but it's a very self-contained story. Let's put it that way.
Well, the two leads in that movie, I think, were about as bland as you get in because you can barely can you even remember their names? Like they're just very forgettable.
Yeah, it was beautifully filmed. I think.
Yes.
Because I'd grown up watching the originals, what I first responded to with Rogue One was just like how good they got it. Like in terms of making it look right. Yeah. So it's a somewhat aesthetic kind of judgment, I suppose, but I really liked it on that level. With the prequels you're talking about, I was really fascinated growing up by the character of Darth Vader, and the story of the prequels is really the story of Anakin Skywalker, right? And his transition to the dark side. So I think the story line there is great. Everyone hates Jar Jar Binks, though, right? Like maybe we get too hung up.
It's funny you bring up Jar Jar Binks because, and we're talking about mental health today, because the actor was harassed so much that he actually was contemplating suicide. I'm not sure he may have attempted or not, but it's terrible. Yeah. I never actually cared too. I didn't really care that much about the character back then. I didn't like the movie when I saw it, but I didn't. Yeah. I didn't never really understood it. Some of this stuff, especially when social media came out, they take on a life of its own, and sometimes people have become extremely negative about something, and everyone gets on the bandwagon, and it doesn't actually reflect. Yeah. It's so extreme that it doesn't. It's become.
That's a very Star Wars thing, though. Like, I mean, it's not exclusive to Star Wars, but like Star Trek and like some certain franchises, like the fans feel they have an ownership of it. Like, they get sent up with characters in The Simpsons, like, the comic book guy and that kind of thing. But I had an argument with someone once because I expressed my fondness for Ewoks. And he said, well, Ewoks could never defeat, the Imperial Guard or something like that. It's just like completely unrealistic. And I'm like, maybe it is, but I just really like Ewoks. Like, I think they're cute. Not a good response from me, apparently.
No. Well, that's another one, right? That's where people kind of grew up, and when they were kids, they loved that movie, and it was like their favorite one. And then when they grew up, they decided, no, that's for kids, and decided, no, some things are right and some things are wrong. And I think that's probably a good topic for a future podcast. That the world of social media now is forcing everyone into like a black and white two camps thing for everything. And you can never have a nuance. Everything's either someone's 100% right. So let's say if you're a Democrat in America right now, it's like 100% you've got to be behind the Democrats. You couldn't put up and say, oh, I'm not really sure about this Biden guy, because no, you've got to be 100% aligned. And then if you have any sort of, discussion around, well, maybe I can be a Democrat and support this, but not support this particular person, or I don't particularly support them on certain views. Yeah. And I think the way we look at movies is almost like politics now, and TV shows. It's like everyone will go, oh, everyone knows that all the Star Wars stuff was terrible after Return of the Jedi, and then and it's almost like you can't disagree, or you can't have somewhere in the middle.
Almost a pressure to like certain things or not like certain things. Like, actually, I really loved Schitt's Creek, which recently won a whole bunch of Emmys. But it's funny with that show, like most people, it took me 3 or 4 episodes to get into it. But then I know some people who just didn't like it, and that's okay. And I'll have this experience sometimes where everyone will love a show, and either I don't like it, or I haven't really got around to watching it, or whatever, and you either feel left out or you feel, shunned almost. It's like, well, why don't I like this thing that everyone else likes? This is something wrong with me. And like The English Patient, in Seinfeld with Elaine, like she goes to see the movie The English Patient and she really hates it. Yeah. And then everyone loves it. And she gets to the point where she just starts lying and says that she hasn't seen it, but then people start taking it back. So she has to see it again.
I know. Yeah, that's right. There's things like Game of Thrones is one of them, where people who haven't watched it and they kind of get almost a little bit irritated if you tell them it's good, because they're like,
they get defensive about it actually. Yeah. It's okay. Like, you don't have to like it. I get that.
And I actually, is it Schitt's Creek? Is that Christine and I watched that, and I'm in the camp of everyone keeps saying that you got to watch more episodes. We watched I think 3. And it wasn't doing it for me still. I didn't dislike it. I was just like, I don't see what the big deal is. But then...
I get that. Like, I just kept watching it, and it goes in a really different direction. I don't know what happened with the writing and stuff, but at the beginning of that show, I thought it was going to be like Gilligan's Island, and every episode would be about them trying to get out of this town. And it doesn't turn out like that at all. It has some incredible storylines in it, but it's okay if you don't like it or you don't have time. Like there's we live in this golden age of TV, right? There's so many good things to watch. You can't necessarily get into everything.
One show I highly recommend if you ever watched it, I know Ramsay's a fan, is Arrested Development. Did you?
Yeah, I love that show. Yeah.
Yeah, that's definitely a show I think that takes a few episodes, because some of the jokes only pay off in like after several episodes. You've got to be very patient.
I've lost the thread of the storyline in that show a bit. Yeah.
It's pretty good. Like the latest seasons were not as people didn't like them as much, but I've got another a lot of people said like season 4. So there was 3 seasons. It went away, and then actually Netflix, which everyone watches now, was actually launched off the back of the return of Arrested Development. So that was what made it put it on the map, because it picked up this pop culture following, and then Netflix said we're going to bring back Arrested Development, and everyone didn't really like this season 4 because it was this really odd sort of structure that they used, and I actually think it's my favorite season. It's a really, I don't know if you watched that season, but it's basically like one long movie that's cut into sections.
Yeah, I think I've seen it. It's where like George Michael becomes George Maharis and maybe like masquerades as an old woman. Yeah, I have. I don't think I've seen every single episode, but I probably need to sit down and like work out what I haven't seen and catch up. But I enjoyed it. Yeah, absolutely.
Yeah. All right. So I think that wraps up today's podcast. It's episode 4. So Cameron, just a quick test, a Star Wars test. What was episode 4? Which Star Wars movie was that?
That was A New Hope.
Very good. I'm glad. All right, good.
The best one is Return of the Jedi, though. Everybody knows that.
Are you debating me?
Because it shows the Sith on top, which is what people want to see.
No, everyone knows The Empire Strikes Back is the best film, and you can't disagree with that.
Yeah.
Yeah, we have to be...
All
right. Well, I think on that note, like all our episodes, we're not going to wrap up in a clean way. We'll just end this and finish up, and I'll see you next time.
Okay.